My name is Chelsea Hansel, and today I'll be talking about Clostridium difficile. Clostridium difficile, aka C. diff or CDI, which is Clostridium difficile infection, is a spore-forming bacteria that is very hard to kill. It usually is acquired as a reaction to antibiotics. Because antibiotics fight bacterial infections by killing the bad germs, sometimes they also get rid of good germs that protect the body against harmful infections. It can be spread by contact, and symptoms range from simple diarrhea a couple of times a day to life-threatening colon inflammation. CDI typically affects adults or people who spend a long time in a healthcare facility, and it usually just occurs after the use of antibiotic medication. However, recent studies are showing that the rates are increasing among young and healthy people who have not used antibiotics or been in a healthcare facility, and they are unsure why the cases are rising the way they are. CDI bacteria is found in soil, air, water, human and animal feces, and food products. It's mostly spread by fecal matter onto surfaces, food, or other objects, and the bacteria lingers on surfaces or in a room from weeks to months at a time. So one could unknowingly swallow this bacteria, and it produces harmful toxins that destroy the small intestine, and they produce inflammatory cells that cause watery, foul-smelling diarrhea. In a mild to moderate case of C. diff, your symptoms would range from watery diarrhea 3 or more times a day for 2 or more days, and abdominal tenderness, mild cramping, nothing super serious, which is why a lot of people let it go longer than it should because they don't think that it's anything more than just a flu or a bad case of diarrhea. The symptoms get much worse in a severe case of CDI. They could be watery, foul-smelling diarrhea 10 to 15 times a day, high fever, blood or pus in the stool, nausea, dehydration, severe abdominal pain, weight loss due to the loss of appetite, a protruding abdomen, a rapid heart rate, increased white blood cell count, or even kidney failure. If those severe symptoms go left untreated, they could become life-threatening. They might include intestinal inflammation, toxic megacolon, or sepsis. And in those cases, the patient would be admitted to the intensive care unit. In order to diagnose CDI effectively, a bunch of tests could be done. There's a number of different types of stool tests, as well as a colon examination, like a colonoscopy, or imaging tests. The patient would be sent for an abdominal x-ray or a CT scan, and these tests would provide images of the abdomen to visualize the colon. So on the left here is an abdominal x-ray that visualizes pneumoperitoneum and perforated megacolon. And on the right is the CT scan that visualizes a thickened colon wall. Both of these are signs of C. diff. There are many complications associated with CDI. Excessive diarrhea can cause dehydration due to the lack of fluids, which prevent the body to function normally. The rapid dehydration can also cause the kidneys to begin to fail. If a patient experiences megacolon, it could cause a bowel obstruction, and if it's left untreated, the colon could even rupture, causing all that bacteria to flow freely throughout the abdominal cavity, which increases the risk of death. All of these complications require immediate medical attention, or they may become fatal. There are some treatment options for this disease. First of all, if the patient is confirmed to have CDI, they need to be completely isolated. So they'd be put in their own separate room. Everybody needs to wear gloves and their PPE when going around this person. But to prevent the infection itself, you can avoid the use of unnecessary antibiotics. Cleaning thoroughly, hand washing is the most important since it is spread through contact. And the first thing to do was to stop taking the antibiotic that triggered the infection to begin with. However, ironically enough, one of the main treatments is more antibiotics, just different antibiotics that hopefully won't cause this infection again.
They say patients need to take their health into their own hands. Well, that's a lesson a woman in Muscadabat Harbor says she's learned the hard way. She's recovering from a bout of C. difficile, and she wants people to take the risk of the disease seriously. Shayna Luck is live now with more. Shayna.
Tom, 3 weeks ago, Judy Farsi says she had a brush with death. She believed she had the flu, but when her husband rushed her to the hospital, they found out it was C. difficile. Judy Farsi's going easy on her stomach. Her husband Ken prepares her lunch, Jell-O with whipped cream. She isn't back on solid foods after 2 nauseating weeks of vomiting and diarrhea.
I kept saying, I have the flu, I'm not going, not going to the hospital for the flu. And he said, finally, I was so delirious, I couldn't control my bowels or nothing, that he said, something's not right, we're going.
It was C. difficile. She doesn't know how she got it. She was rushed into surgery to remove part of her colon. Her husband believes if he had waited even a few hours longer, they would have lost her.
They made it clear that, this was serious, that it was close. If I had hesitated, she wouldn't have made it.
C. difficile is transferred by contact. As she recovered, everyone around Farsi had to wear gloves and gowns. But when she was moved to a general ward, Farsi noticed on 2 occasions some nurses weren't wearing gloves. One day, a doctor noticed and scolded the nurse.
She said, we have a sign posted above our bed, we have a sign on the door, that you are supposed to be wearing gloves.
Farsi also says nurses let her share a bathroom with 2 other patients, which the hospital's safety measures don't permit.
It's easy to say, well, they just forgot. Yeah. But one time is maybe too many.
Farsi says she understands how lapses in safety might happen.
This patient needs you, and all of a sudden, oh my God, I forgot my gloves. That type of thing. And I just don't think that they know that C. diff is a killer.
After what she suffered, she says she's extra cautious about spreading disease. Capitol Health's numbers do show that infections of C. difficile in the hospital have gone down in the last 2 years. And the hospital says that it has ongoing education to teach staff about safety procedures. But the Farsis are still uneasy about what happened to them, and they say that hand washing has become a part of life for them now. Tom?
That's Shayna Luck live in Halifax. Thanks, Shayna.
What are some symptoms of C. diff?
Yeah, so symptoms of C. diff would commonly be fever, really bad abdominal cramping, constant diarrhea that is non-remitting. When I say that, I mean usually we see people that are going 10 to 15, 20 times a day. I mean, if you get it, this is like the worst diarrhea illness you've ever had in your life. Usually we don't see blood commonly in the diarrhea, so if it's just like water is what we usually say, that's more likely to be C. diff. And then obviously nausea, vomiting, inability to even eat anything can be the symptoms of it.
In those situations, hospitalization necessary?
Yes.
I would think because of that dehydration.
Yes. So I see kind of sicker people because I deal in the hospital, but most people with C. diff, especially if you're over the age of 50, you're going to be hospitalized because it's such a severe illness. The amount you can become dehydrated, it can affect your kidneys, it can affect other organs. Most people end up getting hospitalized just to make sure that they're getting hydrated, they have pain control, and they can get the right medications.
And how do we treat that C. diff? With what?
Yeah, so interestingly enough, actually, we just changed the guidelines in February of this year. It used to be that we would use one intravenous or oral medication called Flagyl. Now the International Society of Infectious Disease Guidelines and gastroenterologists have realized that vancomycin, taken orally, and orally only, not through the IV as we use with other diseases, actually works better, and we're more likely to prevent it. There's a bunch of other medications now on the market. They've even made a specific medication that affects the antibodies associated with C. diff that's an actual therapy, kind of like what they do with chemotherapy now. So this has become such a problem that they've actually done a lot of biochemical research and figured out what kind of things they need to target in order to keep people safe.
And if someone is caring for a family member who has C. diff, should they worry about being contagious?
Yes.
Really?
Yes. This is one thing that I think really needs to get out there. So if you are taking care of someone with C. diff, there is a reason if you've been in the hospital why we wear these huge gowns. We're gowned up, blue gowns, have gloves, and we don't even wait to leave the room until we've taken them off because we know it's so infectious. The other thing is normal things don't get rid of it. Hand gel, that Purell, does not kill C. diff. It does not. You have to wash your hands. You have to use actual soap and water. This bug is so smart that it has outsmarted Purell. So at this point, if you were taking care of a family member, be careful, wash your hands. We usually bleach and sterilize the rooms. They're especially marked if they've been in it.